Everybody, and welcome back. My name is Louis Bernetti, and for our final topic of our stroke education series and discussion, we're going to be talking about psychiatric challenges that might be occurring following a stroke. So, as always, I'm going to first start by sharing my screen so we can kind of go over the information at the same time. And so, like I said before, this is going to be psychiatric conditions following a stroke, and we're going to be talking about potential psychiatric challenges following a stroke. But as always, this is not an all encompassing list of different psychiatric conditions that can occur following a stroke. So just keep that in mind as we move through these. These are just typically the most common, and always speak with your primary care physician or neuropsychiatrist if you have concerns about other challenges that you might be facing. All right. So to begin, we're just going to kind of go over a little overview of all of them. So we have post-stroke depression, anxiety disorder, apathy, catastrophic reactions, and then pseudobulbar effect. And so what the percentage here on the right side is saying is how common these are within survivors of stroke following their first stroke. So here we see that post-stroke depression is typically the most common, with 35% of survivors of stroke identifying that they have this experience, with 25% saying they have anxiety disorders, 20% apathy, 20% catastrophic reaction. And I don't have a percentage by pseudobulbar effect because that is typically harder to measure, but we will just be going over what that is and what it looks like later on. So to start off with post-stroke depression, if you see me again looking over to my right over here, just having a couple notes here that I want to make sure I hit up on. So I'm giving you guys all the best information that we have. So with post-stroke depression, that is what typical depression looks like. It has the same type of symptoms: sadness, lack of energy, lack of motivation, very self-critical, and a lot of guilt. So that is a kind of broad definition of what post-stroke depression is. But the way it differs from other types of depression is that this is a type of depression that occurs following a stroke. So, for example, let's say you are diagnosed with depression before you have a stroke. And then after your stroke, the diagnosis would then switch to post stroke depression. Or, for example, let's say you have never experienced depression before a stroke, but now you've had a stroke and you're starting to have these kind of symptoms, and then it's called post stroke depression. So, any type of depressive symptoms that come following a stroke are going to be classified under post stroke depression. And so, ways that you can combat post stroke depression are speaking with your psychiatrist or primary care physician about any antidepressants that would be recommended, in conjunction with psychotherapy. So, when prescribing antidepressants, yes, there are medications that can help with depression, but like many things, just taking the medication itself without making other changes in our life in the way that we're navigating the world, it's not going to be as effective or as impactful. So it's the same thing with antidepressants. So it's wonderful to take antidepressants to kind of help that, but antidepressants aren't a happy pill per se. They are a medication that is meant to kind of help with the chemical imbalances within our brain, and they're more so to help bring us back to baseline, right? They're not meant to go above, meant to go to below. They're just trying to get you back at that baseline of just feeling. So with post-stroke depression, when you take those antidepressants, you're getting back to baseline, but then when you're at baseline, you're still having these challenges that are there after a stroke. So with relations of psychotherapy and learning how to come to terms with these changes, or learning ways to kind of be patient with yourself as you continue recovery and make gains, kind of having those interactions, those conversations, along with the medication, is going to provide better outcomes for individuals. So that is important to note first. Next is to engage in physical activity and exercise. One of the greatest things for depression to help fight against it and combat it and decrease it is to stay physically active and engaged. It can be very difficult to want to stay active and engaged when you're experiencing these depressive symptoms, but typically following any type of activity or exercise is going to increase our blood flow, it's going to get our bodies up and moving, it's going to increase the attention going to our brain throughout our body, it's going to release these endorphins, and you're going to start to feel better. So staying up and staying engaged and not just letting yourself become sedentary is very good also to help prevent any type of depressive symptoms. And activity and exercise can look many different ways. That doesn't mean you have to go to the gym and do a really intense workout. Exercise can be going for a walk, it can be doing your laundry, it can be cleaning your house, it can be playing you know games, whether that be, outside, like outdoor activities or even indoor activities, anything that gets you up and gets your blood pumping and kind of gets you working up, even a minor sweat is going to be beneficial. And so now we're going to move on to anxiety disorders. And so, oh, sorry, before we go on, I do want to also emphasize with post-stroke depression, along with all of these, the best way to also kind of overcome these challenges is to continue to participate in meaningful tasks. That can look challenging after a stroke. Maybe these tasks and activities that you found meaning and purpose in have become more challenging to engage in because of your stroke. But not giving up and speaking with an occupational therapist about ways that you can adapt these activities or ways that you can come about these activities in a different way so that you can still get the same meaning out of them as you did before, whether that be because they look a different way or you find a different substitute activity. Don't give up on things that brought you joy. A stroke doesn't have to take away the things that you've enjoyed in life. And so, be open to different ways to complete activities, be open to that, change being a more slow process, but it's still occurring. And just be open to, learning new activities or, taking that time to kind of develop the way to continue to do the things you wanted to do. And that's going to help with all of these areas as well. So now we're going on to anxiety disorders. And about 25% of survivors of stroke say that they experience an anxiety disorder following a stroke. So anxiety differs from depression because anxiety is a constant fear or feeling of kind of unsteady or unease and vulnerability. So think of it as always just being very high strung, neurotic, anxious, nervous, and you can't really identify why. There's this kind of pressing feeling on your chest. You're just kind of nervous. You're kind of wound up tight, you feel like, but you can't identify what's causing these feelings. That's typically what an anxiety disorder is. So ways that you can work with anxiety disorders, again, there are types of medication, much like the depressive medication, in conjunction with psychotherapy can be very beneficial. Engaging in mindfulness and pursed-lip breathing. So with anxiety disorders, the way they become out of hand and things like panic attacks or anxiety attacks can occur is that our anxiety goes unchecked. So when you're starting to feel that kind of sense of like that kind of deep pressure on your chest, this kind of wound up tight feeling, take a moment to step out of the present moment of this anxiety and be very mindful of just what's occurring at that moment. So mindfulness is a very effective strategy to kind of reduce those anxious symptoms that are coming up out of nowhere, because you want to stop them before they snowball into something greater. So a way that you can do that is focusing on breathing, doing pursed-lip breathing, that inhale through your nose, exhale through your mouth, and do that until you finally feel your kind of blood pressure. You feel like it kind of goes down. You feel yourself calming down a little bit. Breathing, as many people have said before, I can't emphasize that enough. Breathing is one of the best strategies to use with anxiety. And many people ask, well, why is breathing so effective? Well, again, anxiety is that kind of, our body is in fight or flight at that point. It's in a state of panic and a state of anxiousness. And so all of your body, you're wound up, signals are firing, you're getting really worked up. When you take your time to stop and breathe and force yourself to get out of that rhythmic cycle of fight or flight, your body's going to calm down. It's going to relax. It's going to realize it's not in danger. It needs to realize it can calm down. And that breathing is what triggers that. And that's what's going to release and kind of get rid of those anxious feelings. Although it might not be permanent, it can get you to come to a point where you can get control of yourself and you can identify what it was that was maybe making you anxious, or, you can get help or ask somebody to help you. Another thing to do is to plan worry times. So many times with anxiety disorders, it's unlikely, it's challenging to say, well, just be mindful, do your breathing, and you'll be fine. Doesn't make it go away, right? Those worries or those concerns still there. They've just been kind of pushed away for a second. So if you find yourself not being able to kind of get off of that, plan worry times. And what I mean by that is allow yourself 10, 15, 20 minutes that you have allotted a day where you sit down and you let yourself have those feelings. You let yourself feel these. You let yourself feel this anxiety, this worry, this fear, and recognize them, feel them, and identify them. And then at the end of that time, come back to the present. And because it's better to not just keep pushing these feelings away, And it's not likely that we can just say, forget about them. So allow yourself to worry if that makes you feel better. Some individuals do feel better after they've been allowed to kind of express why they're worried, or allowed to kind of sit and fester on what's worrying them. And if that works for you, then go ahead and do that. But it's good to schedule time so it's not constantly happening throughout your day. So if you feel yourself starting to get anxious, you can go, oh no, I'll worry about that when I have it scheduled, after lunch. Right now, I got to get this stuff done. We'll check in with that later. And that's also been proven to be beneficial. The next is to know your anxiety. So take notes of when it's worse or better. Is there a certain time of the day that you're more anxious? Is there something that you ate? Maybe if you have, foods that are high in sugar or high in calories, or maybe it's early in the morning or late at night when you're going to bed. Maybe you're more anxious before you exercise as opposed to after exercise. Take notes of when your anxiety is peaking and kind of going down, so you can recognize how you feel. When I feel better, like I feel better in the morning, and I feel better after I drink some water, and I feel better after I've done some exercise. So you know what works to kind of help mitigate those feelings. Next up is apathy, which is about 20% of individuals experience apathy following a stroke. So apathy is the disturbance in motivation, low initiative, and challenges with starting and sticking to goals. So apathy is that kind of feeling of just like, I don't know why I'm even trying. I don't know why there's even an effort to try to get better. I'm not the individual I was before. All these kind of negative self-talk feelings. So the best way to work with an individual who has apathy, or if you yourself experience apathy, is to first start with honest and realistic goals. And this kind of goes back to our recovery timeline. But be honest and set realistic goals that can be accomplished. This doesn't mean that you have these major goals that you can't accomplish, but instead of having this, like, let's say, for example, your goal is to get back to driving. That's a wonderful goal, and it's a big goal, but that shouldn't be your only goal. Have smaller goals that build up to driving. So you're not just working towards this one major goal and you don't feel like you see any progress because you're not recognizing the small gains you're making. So there's a lot of things that go into driving. That includes our ability to maintain attention, our focus, our motor control, our strength, endurance, our balance, our ability to, coordinate our feet, our hands, our eyes, our neck, everything. All of these movements that involve with driving, are going to be small goals that you're accomplishing. So you're getting more, let's say, comfortable with seated posture and balance. You're more comfortable sitting up and you're able to maintain it. You're getting better at visual scanning. You're able to find things and locate things quicker. Your coordination's getting better, getting faster. These small goals that you're setting that will eventually lead up to build up to the foundation of that large goal. Because when we have this major goal that we're having a hard time reaching, we just feel as if we're failures. So set yourself realistic, smaller goals that work as stepping stones towards those big goals you may have. The next one is to grieve properly. A lot of the time in American culture specifically, we don't allow ourselves to grieve for loss. And it's important, especially, to grieve for yourself during these times. A stroke is a major event and it can have a major impact on your life and the kind of outcomes after. And yes, it's important to remain positive, but there's also a thing known as toxic positivity, where you're not allowing yourself those feelings, negative emotions and negative feelings, sadness, anger, frustration. Those aren't bad. Those aren't unhealthy. They can become unhealthy when they cause distress or dysfunction, but they're normal feelings of the human experience. So allowing yourself to feel those feelings following a stroke is important. You need to be able to grieve yourself properly so that you can continue to build up and work towards those goals and changes that you have for yourself. Because if you don't, then you might have this kind of built up apathy and kind of anger and resentment towards yourself or others because you didn't have the proper time to really kind of digest and let yourself feel those feelings at the very beginning of your journey. And then the next one is to focus on the process and not the outcome. That kind of goes back in line with the small goals leading up to the big goals, and that it's more important to focus on the here and now and see where that leads to, as opposed to having this one directive goal that we're looking for. So next one is our catastrophic reactions, and that is also about 20% of survivors of stroke. And this is outbursts of emotion, whether that be anger, crying, agitation, or anxiety. So individuals who are survivors of stroke may have these types of reactions, and that might be due to damage in the nervous system. So the best way to handle this as a care partner or caregiver is to listen and validate the individual. Stay calm, remain reassuring. The individual at that moment in time is not in this state to be reasoned with. So if you feel like you've done something and there's this major reaction and you don't think that was the appropriate reaction at that time, and maybe it wasn't, it's important that you still let them have that reaction, either step away or give them their space, then circle back to that once they've calmed down and they're kind of back to how they were before and have the discussion following that. But don't try to have this discussion with them during it because they're not in the moment in time where they're really ready to be kind of hearing that. Because again, it's a neurological condition and it's something that they're just having to go through and let it kind of cycle out and then have that discussion. And then next is that individuals who are easily overwhelmed may respond with emotion. So maybe as a care partner or caregiver, really make sure that you're not overwhelming the individual with new things or, pressuring them to do certain things or activities. Kind of gauge on how they're feeling with their body language, how they're speaking, their cadence, and make sure that you're not over pushing or overbearing because those types of feelings can often lead to catastrophic reactions. And that leads us into Pseudobulbar Effect, also known as PDA. And what this is a neurological condition that results in either uncontrollable crying, laughter, or varying different emotions without what would be deemed a logical or appropriate reason. So, for example, an individual may be laughing at something that could be considered quite sad. So, if you're with an individual, you notice that they're laughing at things that maybe something wasn't even very funny, or that wasn't meant to be funny, or it's maybe a somber situation, and your person you're caring for, your loved one's laughing. They're not doing it to be potentially, disrespectful or inappropriate. It's a very common thing that can occur following a stroke known as the Pseudobulbar effect. And it just leads to these reactions that might not be appropriate in the setting, but they can't be controlled. They're uncontrollable. So individuals may cry and they may not feel sad, but it's just these emotions that are coming out. It could be a very happy thing, or it could just be, a normal day and you just ask them a simple question and they just start, crying and kind of getting very emotional. And again, that's not anything that you've done or said, but it's just a uncontrollable reaction that can occur. So knowing that and kind of getting that diagnosis can better help you communicate with them and understand, but also help you advocate for the individual. Because if you're out in the real world and you're out talking to other individuals and we're out, in our everyday lives and your loved one may have a reaction, then another person might either come across offended or confused. And you can better educate and let them know, this is, they're a survivor of stroke and this is, a condition that's following from their stroke. This is nothing to be concerned about or to be offended by. This is just a uncontrollable reaction. So you're better understanding how you can advocate for the individual, but also how you can communicate. So you yourself understand, when they're laughing at something, they may not be finding something funny. They could be maybe angry, sad. It's important to not just tie those emotions that we typically tie to everybody else's laughter to them specifically, because they may not be laughing at something because it's funny. It could be a different type of reaction as well. So better understanding so you can communicate with them. Are you okay? Are you sad? Are you happy? Are you angry? Because you can't just go off of the reaction they're giving. All right, you guys. So that's going to end it for our psychiatric conditions following the stroke. As always, if you guys have any questions, please feel free to ask, and we'll see you next time.